We all practice evidence-based medicine. What evidence are you looking at? The most important evidence is coming from you. I value a healthy skeleton. Why? Because I like to not shrink. I like to have my body move through space. I like to have good balance. I like the fact that if I fall, my elastic, rubbery bones are gonna bounce. We have to talk about your skeleton, our skeleton, the skeleton. If we're going to live long and we want to live well, it makes sense to have a strong skeleton. That's what moves us. Now, you can't get there by drug therapy. I'm going to talk about some popular drugs, about osteoporosis, thinning bone. Why does it happen? What can we do about it? And how does it connect to your longevity? And how does it connect to your quality of life? This gets to the heart of the matter. A lot of talk about science as if it's a stagnant phenomenon. That is, science is an irrefutable truth that cannot move. The science says fill in the blank. All right, science is movable. Science is biased. Science can be wrong. Science is a process. So take a room full of experts, and this has been looked at in social studies, a room full of experts, and compare them to a room full of VSPs, very smart people, people like you. We're talking average people without PhDs. Maybe even they have a PhD, but it's not in their area of specialty. What they have found is when you get a bunch of experts together, they argue with one another about whose opinion is best. When you get a bunch of VSPs together, very smart people, they collaborate, they share information, they build a consensus. Because nobody already has developed a dogma that they're latched onto. You get Joe, the research dude, who did the study on fill in the blank drug or treatment, they own it. I'm not anti-science, but I trump science with philosophy and art. You know, medicine is in fact an art. The idea that we can hide behind studies as if they are our shield against criticism is nonsense. Now, I'm going to share with you some study information. I'm going to share with you my research-based clinical opinion. But it's just that. You'll have your own opinion. God bless you. Keep thinking. You know, it used to be easy in the old days, 10 years ago, 20 years ago, when people aged back then. They didn't have to think too much, did they? They just got old. After all, there was no means of altering the process. In fact, aging only recently is starting to be looked at as a clinically modifiable phenomenon. And I propose to you, ladies and gentlemen, that you can change how you age. It is way more powerful than genetics. You know, the whole genome project kind of fallen flat. We thought, hey, we've discovered the genome. We can sequence the genes of Homo sapiens, and we'll use that information to evolve phenomenal treatments and cures. Hey, we've been sporadic. You've seen occasional success stories. But by and large, it's been disappointing. Cancer treatment, they have not found the linchpin gene. How about therapeutic diagnostics? So I have a patient recently with a very rare form of cancer. And lo and behold, he had a sibling with a very rare form of cancer, the exact same cancer. Doctors were mystified. They dug into the genetics. It turns out there was absolutely no gene connection. And yet, two people in the same household, well, you share an environment. So the environmental element is colossal. So let's get back to the bone thing I was talking about. This is relevant. This is important because we do not age in a uniform manner, either individually or within an individual. Your skeleton may age at a different pace than your brain or your heart or your kidney or your joints or your cells or your immune system. When I read other anti-aging experts, And some of them are promoting the notion that you can determine your biological age. Folks, that's a made up number. And primarily, it's made up so they can sell you supplements that will alter your biological age. There's no such thing because we age at different paces. And it helps to know where your primary aging system is. Is it your heart, your brain, your arteries? Where's your primary risk? Of course, we're all at risk for everything, but we can determine the level of risk depending on our history and some diagnostics as well. The skeleton, however, I maintain is neglected, overlooked, and fundamental. There's a powerful connection between muscle, bone, and brain and longevity. So if the skeleton's so important, then how do we take care of it? And what do we do if we have osteopenia, osteoporosis? Well, the first thing you do is you never get a bone density test. Now, why in the world would I say that? Because it's a stupid test that tells us nothing of relevance. Here's what I know for sure. You don't need a test. If you're getting older, and hopefully you are, in the absence of supportive treatment, organic, physiologic, natural supportive treatment, your bones are going to thin over time. To a person, people get shorter as they age. To a person, bones get weaker as you age, unless you replace what's missing and you take the proper action. Drugs are not the way. The reason I don't order bone density studies on my patients is because all of them are getting bone protective therapy such that we don't have to worry about it. Their bones are going to be fine. There's a reason why bone density studies are not recommended for 30-year-olds, 35-year-olds, because they're vital. Their hormones are intact. Their muscles are intact. So no need to get a bone density study. Here's the typical path though, right? To me, getting a bone density, here's why it's dumb. If you're a woman past menopause, if you're a man past 60, and the older you get, the more likely this is to occur, the bones are going to thin. It'd be a bit like taking an ice cube in July, putting it on the driveway, and saying, I'm going to do a series of photographs every 30 minutes and see what happens to this ice cube. It's going to melt. Doing a bone density study is dumb, and doing it sequentially is less intelligent because you know the outcome. Why expose yourself to needless radiation? Because it'd lead to this. Did you know, Mrs. Smith, that you have osteopenia and it could lead to osteoporosis? Oh my goodness, doctor, what should I do? Take calcium. Okay, stop right there. Unless you're desperately deficient or you've got some type of dysfunction of your parathyroid gland, do not take calcium supplement, people. For God's sakes, the calcium you need, you get in food. Plenty of it in good food. Furthermore, calcium supplementation has been associated with possible cardiovascular complications, increased hardening of the arteries. There's something different about the calcium in food. Of course, dairy products are notorious, or I should say renowned, for having lots of it. If you can't take dairy products, there are lots of other foods out there, easy enough to find. Calcium supplementation in men is associated with an increased risk of prostate cancer. In addition to that, it does nothing, no good, no benefit at all to protect your bone if you're otherwise a healthy human with normal eating habits. The idea that giving you a calcium pill, well, that just kind of mollifies a patient in the moment. It's a false comfort. There's nothing worse than a false comfort. Better to be nervous and exposed than to take something that doesn't work in the misguided belief that it can actually help. Calcium pills, mark them absent. How about the drugs? So years ago, when Fosamax hit the market, alendronate is a generic name, we were ecstatic. Doctors, including myself, we prescribed these drugs. Why? Because when they had a bone density study that showed thinning bone, the drug could reverse the process. The bone density study got better. The effect on fractures, Not so much. Over the years, we have come to have these drugs expose their true colors. So this is a common phenomenon with prescription drugs, folks. This is why you should avoid them. And if you have to use a prescription drug, go with a generic. They're older. They've been around. Their warts have been exposed. The new drug on the block, more likely overhyped, overpromoted, overpriced, and unknown regarding its true side effect profile. So here we go with Fosamax. We're all excited. We're prescribing it. The bone density, we do it a year later. It looks better. Problem. These drugs, they're called bisphosphonates, and there are a bunch of them. I'm going to read off their names. In case you're on one, you have my permission to reconsider its use. Fosamax, Boniva, Reclast, Actonel, Zometa, Prolia. Bisphosphonates all have a similar side effect risk profile. Oh, by the way, it is $100 million business plus. These drugs are widely prescribed to perfectly healthy people with bone density issues. So the bone density is not treated by these drugs so much as they alter the appearance on the bone density study. Problem. The quality of the bone is not good. The bone quality is not the same as naturally stimulated skeletal bone. In fact, if you read the fine print, these drugs actually have a warning that they may cause fractures. What? It's supposed to prevent them. Well, it turns out there is a very ominous type of a fracture in the femur. That's the big bone in your thigh that occurs with some of these drugs. Now, it's not that common an occurrence, but it ought not to be happening if the drug is making bones stronger. Now, should it? The drug that is, may make the bones weaker in important ways. Thickness does not beget strength. You can't measure elasticity, pliability, resilience. A good, healthy bone is pliable. A good, healthy bone doesn't break easily. The bones that are exposed to these drugs, not so much. Okay, there's also a complication, a side effect called osteonecrosis of the jaw, which is when the jawbone, well, it kind of falls apart. And there is no treatment for that. And welcome to your lifetime of misery. Now, they'll tell you it's rare, and that's true, but it can still happen. And it can happen to you if you're on this drug. That's awful. More recently, warnings have arisen about esophageal cancer. The drugs are esophageal irritant. That's why they tell you not to lie down. That's why they caution you about heartburn. Other side effects include muscle and joint pain, nausea, kidney problems. The list goes on. Now, look, I understand some side effects have to be tolerated if there's a payoff. These drugs, there's no payoff worth those side effects, folks. I'm sorry, just not there. So what are you going to do? What does Dr. Petteruti think? What is the intellectual medicine, primary care, anti-aging approach to keeping bones healthy? All right, here's the recipe. You start with weight-bearing exercise. Swimming in a pool doesn't do you much good. Walking is nice. I like weightlifting, personally, and also for my patients. You don't have to be a grunt in the gym. Your body weight can be enough. Some squats are absolutely fabulous. Absolutely fabulous. Irrefutable evidence that strength training activity will stimulate your bone. Absolutely healthy. No side effects other than feeling good. All right, maybe you have to put up with that sweaty dude in the gym that didn't wipe off the equipment that he was supposed to. Shame on you. Wipe off the equipment. And yes, get off of the equipment when you're scrolling on your phone. Let us have a crack at it. Anyhow, go to the gym twice a week would be pretty ideal. Strength training, heavy weight, push it. Make sure you're getting good protein intake, folks. You go to the gym, do not go there on an empty stomach. Get about 30 grams of protein in your belly. I like good protein shake before I go to the gym. I like a cup of coffee. It's been shown to be a great pre-workout. Well, what else? Doc, you're telling us obvious stuff. There's a connection between muscle and bone density. More muscle, more bone. What else? Calcium supplement? Absolutely not. How about hormones, people? Absolutely yes. Right? I said a few minutes ago that in the old days, you just kind of grumbled to each other, pushed your cart at Walmart and said, "Isn't it terrible? My back, my leg, you don't know. Oh, I do. It's awful. That's terrible." That was the battle cry of the aged. Let's all take comfort since we're all sinking in the quicksand at the same pace. But you don't have to. You don't have to. In order to build muscle, you need three key ingredients. You must have resistance exercise. You must have adequate, good protein intake. That's at least 3 times a day. All right. Enough with this intermittent fasting. Can we please stop already? It is a horrible idea. I don't know who came up with it. It has no merit. It does not stimulate anti-aging. It is antisocial. It's weird, and it's bad for your muscles. Now, can I say enough bad things about intermittent fasting? It is another gimmick. Wherever you see a gimmick, a book, wherever you see a transient effect, somebody behind it is making a buck. Intermittent fasting will be gone. It's fading now. It'll be gone in a couple of years. And good riddance to it. Although nature abhors a vacuum, there'll be some other goofy fad that'll take its place. But you don't have to worry about it because I'm here to warn you and steer you in the right direction. All right, at least 3 times a day, preferably 4. Personally, I go for 40 grams of protein, and I go to 5 feeding times a day. I'm about a 200-pound man, so that counts. So protein, strength training exercise. What else? Testosterone, your hormone of choice, man or woman, got to have it. How about other supportive hormones? Dihydroepiandrosterone or DHEA. Pregnenolone is a nice thing to have in the mix. How about estrogen if you need it? For men, if your estrogen goes too low, it's going to damage your bone. So you got to have balance. You've got to work with a clinician who's an expert in anti-aging hormone replacement to get the most out of your bone health. Now, suppose you hate the idea of being on hormones. You think they're unnatural. You think they're terrible. I would disagree with you, but it's your prerogative, which supersedes everything about science. Your personal philosophy trumps my zealous belief in the abundant evidence behind hormone benefit because it's your life. Now, if you're not going to do anything regarding hormone replacement, you can defer, slow, alter the decay of your bone with the vigorous exercise that I'm describing to you. Of course, you should not smoke tobacco unless it's an occasional cigar. If it's a really, really good cigar, maybe that'd be okay. And I say that because, in fact, I like an occasional good cigar. I like to believe I'm not killing myself in too much of an advanced manner. How about alcohol? Excessive alcohol is a bad play. We all know that. Modest drink, occasional, no evidence of harm. So there you go with your bones. Avoid non-steroidal drugs like ibuprofen, like naproxen. I mean, take them if you have to because you hurt real bad, just briefly. But do not think that they're going to help you alter the arc of disease when it comes to your joints. And oh, by the way, while I'm touching upon joints, if your joint hurts when you work out anyhow. You cannot rest your joint to good health. The way a joint gets its nutrition, it's not through blood flow, it's through a squeegee effect. The synovial fluid kind of gets pushed into the articular cartilage, giving it health. That's why if you sit around too much, your bones are going to decay more rapidly. We do not wear our bones and our joints out through overuse. That is a falsehood. We rust them out through a lack of use. So get thee to the gym. If it hurts a little bit, buck up, find a way around it. And listen to my podcast on hormones. I mean, by now, hopefully you're coming around. We've led the region in testosterone therapy for women. No, you're not going to grow a beard. No, you're not going to become androgenized. Those are false fears that are being promoted by some. What's going to happen is your muscles are going to grow. And when the muscles grow, the bone gets thicker and healthier. No, We don't need a bone density study to show that. We know it happens. The research is unequivocal. And here's the big bonus: bone, muscle growth correlates with healthier brain. Osteoporosis, thinning of the bone, increases dementia risk. Now you get a 0 for 2. Your bones are crappy. You got that hunchback thing going on. You're shuffling about with your cane, and now your brain is starting to fade. And you think this is just your aging process? Think again. It's not chronologic. It's not because you've been on the planet for this many years. It's because your gonads have stopped working and they haven't been replaced. That is categorically dumb. When an organ ceases function, you help it. If your pancreas stops functioning, you become diabetic. You don't just say, oh, well, I guess that's aging. No, you take insulin if you need it. If your thyroid stops functioning, you don't say, well, I guess that's about all she wrote. No, you take thyroid hormone. Your gonads stop functioning. Why do we get all twitchy about replacing hormones? Why do we get all twitchy? There's a lot of subconscious, psychosexual, chauvinistic, misogynist thinking behind that. It goes beyond the scope of today's podcast, but having said all those words, gives you something to think about, right? Medicine is not science. Medicine is art. There is way too much unknown for us to be that dogmatic. There's this, let's call it a false bravado in medicine, where some doctors will say, I practice evidence-based medicine, as if that were your shield against criticism. We all practice evidence-based medicine. What evidence are you looking at? The most important evidence is coming from your patient, from you. What is your philosophy? What's your story? What do you value? So I value a healthy skeleton. Why? Because I like to not shrink. I like to have my body move through space. I like to have good balance. I like the fact that if I fall, my elastic, rubbery bones are going to bounce. They're not going to crack. So get on this now, folks. You want to live to be 90? Of course you do. Why not? We're only alive once. We're dead for a long time. Let's live it up. Let's live it up with a good skeleton. And let's get rid of drugs that don't work. Let's call it like we see it. These drugs, they don't work. Why are they still on the market? Because it's multi-hundreds of millions of dollars. This is one of the problems with our system. And the problem, I would dare say, is with us. Now we have the internet. Now we have artificial intelligence. Now we can search anything. Everything I've said today, you can research it on your own, and it will be backed up because, well, that's where I've come from, an evidence-supported perspective. And then you can reflect upon what you want to do with your life. We all must die, but we get to choose how we're going to live. And when you get to that terminal phase, will you have lived at your highest and best level? Well, you will have if you are proactive in the choice. Freedom of choice, that's a cornerstone. These drugs ought not to be offered to you as the only alternative for your issue with bone density. So, doctor, I don't want to take the drug, and I don't want to do any more bone density studies. Let's look at my muscle mass, right? In our office, we have a body analyzer. I think they're a wonderful piece of equipment. There are some high quality units, maybe one at your gym. It could tell you muscle mass percent body fat. It's worth knowing, and it's worth tracking. It shouldn't go down every year. It should stay the same. Your muscles that you have today, you should take to your grave. Just because you're getting older doesn't mean you got to say goodbye to muscle or to bone. Say goodbye to the drug. Say goodbye to calcium supplements. And say hello to healthy eating, high protein, strength training, and by golly, welcome hormones into your life. Well, that sounds like a concluding phrase, doesn't it? But wait, there's more. My 60-second take. I don't know if fluoride is good or bad in the water or anywhere else. But here's what I do know. I don't want to have it imposed on me. I don't want any drug, supplement, or substance imposed on me if I can, in any way, shape, or form, have a choice about it. So please don't put it in the drinking water. Please label food properly so I can make choices about what I'm putting in my body. Hey, if the government thinks fluoride's so important, mail us all little packets of fluoride. We could put it in the water if we feel like it, right? Now, I don't know if it's going to lead to some cataclysmic event for mankind, but I do know that it goes against my philosophical and my moral orientation, which is simply one of maximizing your freedom of choice when it comes to your body and your health. Medical extortion, coercion is out there. Doctors sometimes not sometimes, almost always, put their thumb on that scale and with their authority can pressure patients into making decisions when really we should be taking a step back and giving you space to think. And now, hopefully, I've given you some things to think about. Well, thank you all for being part of this podcast. Look forward to our further conversations. Talk to you next time.